Assalamu alaikum viewers, this is Dr. Naeem from Boulder Complete Center. We have got a gentleman here. We are going to ask regarding his problem and how did he benefited through this Sunnah treatment called Hijama. So, Assalamu alaikum brother, how are you? Okay? Okay, do you mind introducing yourself? If you want to mention your name and age.
My name is Mohammed, I'm 22 years old and this is my third session with Dr. Saad. Alhamdulillah, there's been a big difference in the treatment I've received from him so far. The problem that I've had is that from the back of my thigh, I've had pain going down my leg, so the symptoms are sciatica-like. Obviously, with some sciatica condition, generally it starts from the lower back, and I've seen the doctor multiple times. I've been to A&E, I've been to out of hours, I've tried different medications for the past 6 months, but alhamdulillah, since I've come to Dr. Saad, there's been a big difference. I've stopped taking the medications now as well, and my leg, I couldn't walk for more than 10 seconds properly. Now alhamdulillah, I can pray namaz properly, I can stand up properly, my posture's better, and there's been a big difference.
Okay, so going a bit more in the details of your issue, did any of the doctor tell you that it's a sciatica?
The physiotherapy, I also had physiotherapy sessions, and the physiotherapist I was referred to, she said there's obviously what symptoms are sciatica-like.
Sciatica-like, okay.
But the doctors that I saw at the GP, they were my doctors, they were locum doctors.
Okay.
And they were ruling sciatica out by more than 50% because of my age. And because of where it started, the back of my thigh. So I didn't really get a conclusive answer about if it was sciatica or not.
Okay, so let's put the diagnosis on the side and let's concentrate on your issue. You said your problem was 6 months, ongoing for last 6 months.
More than about 6 months.
More than 6 months, okay. So it was continuously pain on your thigh, one of the thighs, or back as well?
It started from the back of my thigh. Alhamdulillah, my back's been fine, but it started from the back of my thigh and it just used to run down my leg.
Okay.
So I used to get pins and needles.
Okay.
My feet used to get numb. So there was no sensation. So
okay.
And hence, obviously, I wouldn't be able to stand up for long because as soon as I'd get up, I wouldn't be able to walk properly because there'd be so much pain in my legs. So I used to sit down for most of the day, and even sitting down, there was a lot of pain at times. I think the only solution that I found at times was probably lying down, and during these 6 to 7 months, there was a point where even lying down was very bad. So there was different times where it got really bad, and there wasn't one point where I felt like it was going to get better. And alhamdulillah, I found out about you, and I've tried this sunnah treatment.
Yeah, alhamdulillah.
Allah's given me shifa.
Alhamdulillah, alhamdulillah. So going back to the issue again, how bad was your problem? You said you couldn't stand up. So, pain-wise, if you were to score back then 10 as a maximum, how much was the pain?
Definitely 10.
10 out of 10. So it was very miserable then for you.
Because if you can't do the basic things as in walking, standing up, for more than a few minutes.
So you couldn't do namaz and nothing?
Obviously namaz was very hard for me. I had to stand up and pray, obviously, but it was very hard. It was very
hard?
Yeah.
Okay. And how many times did you see the physiotherapist? How many sessions have you done with her?
At first, I saw the physio at the doctor's surgery.
Okay.
Saw him about 2 times. And after that, I was referred to I think a more senior level or a different physiotherapist. Okay. And I did about 3 to 4 sessions with her, and there was no improvements. Obviously, she wrote back to my doctor saying to try something different. Something different,
okay. And what was the medication you were put on, and how long have you been taking medicines for?
So to be honest, I've tried different ones. So I think initially, obviously, standard painkillers, paracetamol, ibuprofen, and cocodamol.
Okay.
Obviously, that wasn't working. Then I was given Zapain, which is a mixture of codeine and paracetamol. But obviously, it's 4 times stronger than cocodamol.
Yeah.
So that wasn't really working as well. Then I was given nerve medication called pregabalin.
Okay.
So it increased my dose. That didn't really affect the pain as well. And at one point, I tried naproxen as well. So during these months,
So you took Zapain, you took naproxen, you took ibupara. And so did you get any relief during the,
no relief.
what you can say, how long the medicine was working? Did you see any of the difference?
I didn't see no relief.
So no relief?
No relief.
So it was continuous pain in spite of you taking all those painkillers.
Yeah.
Oh, and since 6 months or more than that, you have been taking those medications as well. On
Probably-
and off.
It's been probably less than 6 months because obviously at first the pain it started off differently.
Okay.
Obviously it turned into this, but it's been like this for I'd say about 4 months.
Oh.
So painkillers, yeah, probably for this period.
Oh, right. Okay. Okay.
And I think at one point I was just taking it for the sake of it.
Mm,
I thought if I just take it,
Yeah, because you were taking, but it was not making any difference. So you didn't have much of the faith on taking, but you were taking because you haven't got any options.
not any options. I thought
Oh,
if I
right,
stopped
okay.
taking it, it might get worse.
Mm.
Because I thought maybe because it's not getting better, that doesn't mean it's getting worse as well. So I thought if I stopped taking it full stop,
Okay.
it might get worse. But alhamdulillah, obviously 3 weeks ago you fully told me to stop taking it.
Yeah, yeah,
And I've stopped taking it, and then
yeah. Was it from the first session I told you to stop
the
it?
second session.
Second session. All right. Okay.
And I've not taken it since then, and alhamdulillah.
So
I've
it's
fine.
been more than 3 weeks.
About 3 weeks, yeah.
Okay. And how much is the pain at the moment?
Very manageable.
Very manageable.
I think I can stand up, I can walk properly, alhamdulillah. My back is straight,
Can you do namaz as well?
I can stand up and walk
The
properly.
long namaz isha.
Yeah, definitely.
You can do that,
Yeah.
mashallah ta'ala. That's great, mashallah ta'ala. Great to hear
Obviously,
that.
there's more improvement to come because
Yeah,
I
yeah,
can't stand up for long periods of time.
Yeah.
I can still feel the pain if I stand up for longer periods, walk for longer periods. But alhamdulillah, there's been a big difference. So
Okay.
alhamdulillah, Allah's giving me some kind of shifa.
Mhm.
I'm just happy about it.
mashallah ta'ala, mashallah ta'ala. And one small question, because I don't want this video to be very long. Of course, there is shifa in this, and it's the best of the treatment, alhamdulillah, because you stay away from the medication, no side effects. What would you suggest to those people who are very skeptical about this hijama treatment, especially thinking about blood and blade? And so many people do hijama without any medical knowledge as well, which I'm not going to be criticizing them for that purpose. But if a right place is there and right person to go to hijama, what would you say, recommend
I think
them?
obviously there's some people that they're not sure about it. Obviously, do your own research. Ask about this. We've got all the facilities now. We've got so much technology. You can do your own research. If you think about it, in our Nabi's time,
Sallallahu alaihi wasallam.
Muslim, his hijama was done. Obviously, he's spoken about it, and alhamdulillah, I think we should try it. I think before I spoke to you about actually coming to you, one of my friends, he got it done, and obviously he didn't have no pain. He plays a lot of sports, so he just did it for that sake. I thought, okay, I've tried everything. I'm going to give this a go, and I didn't really have much knowledge of it. I thought, okay, if our Nabi has done it, then there must be something right about it.
Yeah.
And I just went in with the intention of that Allah will give me shifa.
Okay.
And
And it worked for you, mashallah.
It's working for me.
You are on path of recovery now, mashallah. Alhamdulillah. Thank you very much for sharing your views on this, mashallah. And just to viewers, to let you know, hijama is one of the best treatment, alhamdulillah. Not because I am doing or brother has experienced good something about there, but it is plenty of that, mashallah. But the world is not aware. Sometimes they don't want to recognize there are so many wrong things out there because there is no money, and how medicines has got involved. The one of the big business, but it's worth to try, mashallah. And please pray for brother Muhammad, me, and all ummah, which is in too much in pain right now as of we speak. May Allah just relieve the problems of our ummah as well. Jazakallah khairan for your views. Thank you very much.